and we might move then on to our third speaker. Our third speaker is Finola McCoy. Finola works with Animal Health Ireland. Finola graduated from UCD in 1997 with a degree in veterinary medicine. So she spent the following 11 years working in various mixed practices in Ireland, UK, and New Zealand. And she joined the Teagasc research team in Moore Park in 2008, where she took up a role as mastitis research officer. While working in practice, she also completed a Master's in Science in Livestock Health and Production through the University of London. Finola was awarded a Nuffield Scholarship in 2014, where she explored the topic of building strong professional teams and networks among rural service providers. She now works for Animal Health Ireland, as I said, as the Senior Programme Manager for CellCheck, the mastitis control programme. This role involves facilitating the Irish dairy industry to work collaboratively to identify and develop sustainable solutions and to continually improve udder health of the national dairy herd for the benefit of farmers, but benefit of industry generally. As you're aware, dry cow therapy is one of the single business reasons for antimicrobial treatment in dairy cattle worldwide. And in the context of the upcoming changes in EU regulations, which will be coming into effect next year, and the whole focus on the appropriate metaphylactic and prophylactic use of antimicrobials, this is a significant topic. So I would say, like, selective dry cow therapy offers an opportunity to target antimicrobials as the cow that needs treatment, and find alternative strategies for those that may not need antimicrobial treatment. So I look forward to hearing Finola speak on the work she's doing in this area. So I'd hand over to you, Finola. Thanks.
Thank you, Martin, and thank you for the invite to speak tonight. I hope everybody, can you see my screen there?
Yes, we can see the screen.
Perfect. Okay. Good evening, everybody. I'd like to start by saying I was delighted to see the proposed title, because while, and as Martin referred to, there is a lot of discussion about the requirement to move towards selective dry cow therapy as a result of the incoming legislation. I think it's also time that we start talking about and look at this as an opportunity and start considering the benefits, because there are benefits. There are many reasons that lots of other countries, including competitors, are already well down the road of selective dry cow therapy, and in many cases without it being a legislative requirement. Looking specifically at benefits, there are benefits for farmers. So very simply, reduced antimicrobial use on farm results in a reduced cost as well, and reduced expense. What farmers themselves also report, and I think this shouldn't be underestimated, is the reduced stress the following spring when you're dealing with a herd where only a proportion of them have been treated with antibiotic at drying off. Farmers also report improved calf health, which is quite possible. While there isn't, while I don't have any clear studies to support this, it's likely that with less residue milk being consumed, there will be a clear benefit and a knock-on effect in terms of calf health and potentially ongoing antimicrobial resistance, or reducing the risk of it within the calf population as well. There are benefits for the veterinary practitioner. So moving or embracing this change towards selective dry cow therapy is an opportunity to get more involved and to engage with clients on overall milk quality and mastitis treatments, and also specifically on the plans for drying off and dry cow management. And in fact, some of these changes or some of these approaches, if you like, can start already through the current structure of the TASA-funded dry cow consult. There are benefits for our reputation as an export nation and for a market brand. The reality is the consumer is becoming more discerning and more demanding, and they expect antibiotic only to be used when necessary and for treatment purposes, and not for preventative or just in case. And finally, it's been referred to many times tonight, but I think we're all very familiar at this stage with the risk or the reality of antimicrobial resistance. There's probably not many of us that haven't experienced it either directly or indirectly. We know the more antibiotic we use, the greater the risk of developing antimicrobial resistance. So conversely, if we can reduce that use, we're all playing a part. And the Minister referred to it, that we can all play a part, and we should all play a part in reducing that risk. So there are many benefits to capitalise on. And I don't mean to sound dismissive or flippant and say that it's not going to be challenging. It will be challenging, but that challenge can be managed with preparation, good management, and good standards of hygiene. And we've already seen this internationally, and in fact on many Irish farms where selective dry cow therapy is already well established. There was some interesting Irish research published recently. It was work done by Michaela Kavanagh when she was as a veterinary student through this qualitative research carried out through semi-structured interviews with participants of the TASA dry cow consults that I already referred to. And I'd like to thank Catherine McAloon for providing this couple of slides and saving me having to compile all the information. But what it looked at was understanding some of the barriers and the facilitators as perceived by Irish farmers. And for farmers, some of the barriers are very clear. There is a fear of selective dry cow therapy. So that fear of the unknown or fear of the potential outcome. In some cases, there's also a reliance on antibiotic, a feeling that they're a necessity and that we can't manage without them. In some cases, there was also limitations in relation to the availability and the use of vets. So some farmers that felt they didn't necessarily have the type of relationship or engagement with their vet that they could talk, that they could work with them on this topic. Infrastructure is a barrier for some farms. And mixed perceptions in relation to selective dry cow therapy. So for some, they accepted that it would save them, that they would save money from reduced products, but the trade-off would be an increased workload because of the requirement to pay more attention to hygiene. And peer influence was also a very, it could be quite a strong or a large barrier at times, depending on what peers or other influencers were doing. And here, just looking at some of the quotes taken from this work, give examples of some of these barriers. So as I mentioned already, the fear of ruining what I have. So if I move away from blanket dry cow therapy, things may go wrong, or I'm afraid that they will go wrong. The next one there, highlighting or documenting that peace of mind that they get. So that security blanket. And this, I suppose this in particular is quite a challenge because the incoming regulations are quite clear that we can no longer use antibiotic in this manner as a security blanket. It can't be, I suppose, a substitute, or can't compensate for any management that should be in place. And the reality there for that, the next particular farmer number 11, the reality of not having sufficient infrastructure or space for the herd. On the other hand, though, there are plenty of facilitators. So for Irish farmers, what they felt was a slow and steady approach. Having a positive consult experience, and the consult in particular is the TASA funded dry cow consult. So for the farmers that participated, that was a really positive experience for them and really encouraged and motivated them to get started on selective dry cow therapy. Adopting a more preventive farm practice, so having those practices in place. For some also, the incoming legislation, which they were aware of at the time, although this research was initially done 2 to 3 years ago before it was, I suppose, as real as it is now. But they did feel that the incoming regulation would be a facilitator. It would require people to change. Becoming more aware of the benefits and understanding the benefits. And again, that peer influence can be a barrier, but it can also be a very strong facilitator. And again, some of the examples or their experiences. The first one here is in relation to the structure of the consult. So whereby they worked with their vet, and the vet gave them an overview or worked with them in terms of their dry cow planning and their current drying off practices. And to get that objective perspective was very informative and very valuable. Some of those farmers, again, while I mentioned that one of the barriers was how they actually work with or what kind of a relationship they have with their vets at the moment, many of them also felt that there was a much greater opportunity to work differently with their vets and that they would like to try and capitalize on that. For some, personal experience, so having had an experience or I won't say an incident, but having knowledge and experience of an antimicrobial resistance was a real motivator or facilitator. And again, this point that I mentioned already about the reduced stress. So again, we shouldn't underestimate this. Many of the farmers reported that just knowing that they had far fewer cows in the herd the following spring and that early lactation that were potential risks for a bulk tank residue failure was a really positive and empowering thing. So how do we actually get started? Well, the Celtic Technical Working Group back in 2018, again, before we were talking, I suppose, specifically about regulation change, developed guidelines or recommendations for low-risk herds. So what they meant, I suppose, by low risk is where there's evidence of good mastitis control. In addition to that, though, in order to facilitate this change, there needs to be regular milk recording. And by regular, what the technical working group mean is at least 6 per lactation. Ideally every 4 to 6 weeks, but a minimum of 6 over the whole lactation. And we'll look at that in a little bit more detail in terms of the rationale or the reason for that. There also needs to be excellent hygiene at drying off and over the dry period and the management of dry cows. And so a suitable or an ideal herd for starting on selective dry cow therapy is one that is already or open to engaging with their professional to get advice and to put a plan in place. And it was these recommendations that led to the eligibility criteria that are now associated or linked with the TASA dry cow consult. The farmers' experiences of this dry cow consult, as I mentioned already, has been very, very positive. If anybody's interested, the consults are still open for applications. They will be for the rest of the month. And in terms of the feedback that we've had, that we've been receiving, the direct feedback from the participants have been that it's been overall a very positive experience. Vets have been well prepared. They have their homework done. They have an understanding of both the farm, the patterns of infection, and the workings of the farm, and the individuals and the staff on the farm. And they're knowledgeable. They provide support, education, and direction. It allowed them to do a thorough analysis of both the farm and the drying off. And again, as we mentioned already, the selective strategy actually helped management the following spring. And one of the elements of the TASA dry cow consult is for the vet to get into the parlour with the farmer and help them dry off or observe them dry off 3 or 4 cows. And for some, I suppose one of the concerns initially was that this might, feel a little bit like a big brother experience. But the reality is, it was one of the most positive things of the consult for the farmers. They appreciated the objective, fresh pair of eyes. And in many cases, for them, it was a validation that they're actually doing a very good job. It's also a good opportunity to share ideas or to share parlour hacks, things that people have picked up or ideas that they've borrowed from elsewhere that can be shared, it could be applied in a different parlour. So it's a great knowledge exchange opportunity. The key things that they focused on, not surprisingly, as a result of the consults, were hygiene, early milk recording, and the dry cow housing. And these are the key elements, as we'll see again in a little while, the key elements that are going to maximise the success of the dry period. The gaps that were identified are what they would like to see more of. In some cases, they would like someone to follow up with them the following spring, which is something that we recommend and we encourage vets to do as a lead on or a follow on from the consult. And also leaving some of the paperwork, and this may have been an admin error in 1 or 2 cases, that the written recommendations may not have been left at the time in error, but were sent subsequently. So overall, very, very positive, a good structure, and a great opportunity for you as a farmer to sit down with your chosen vet. So in most cases, it's your local vet, and that's what we encourage. And that's, again, we want to see that relationship growing and strengthening. That vet has completed training in preparation for these dry cow consults, and it's an opportunity, a funded opportunity, so it's free, and it's 3 hours of the vet's time to sit down, look at all the records, analyse the performance during the lactation and the dry period performance, look at the drying off and the dry cow management, and decide, are there animals that are ready now this year? Could we dry them off without antibiotic, and can we identify which animals they are and put a plan in place? Another question that was asked of those participants was how they feel about not giving antibiotic to cows that don't have any evidence or indication of infection. And from this particular group, for most of them, while they were cautious initially, having gone through the process of sitting down and discussing it with a professional, they were pretty confident. They understood the risks. They knew, they realized that it wasn't risk-free, but they also had a very good understanding of how to manage that risk and how to deal with any outcomes. Some were still nervous, understandably, but they were willing to give it a go. And some, despite having gone through the consult, were still, I suppose, reluctant to change until the point in time when they would have to. And as to whether they felt it was a worthwhile opportunity, again, some of the quotes that I picked out that I thought were quite interesting and summed it up pretty well, particularly the last one there, where I thought it was the best thing I ever did. Yep, I'd recommend it to everyone, even if they had to pay for it. So I think that kind of hits the nail on the head in terms of the value that this person placed on the time that they had invested in this. So what about herds that don't meet the criteria for a TASA tri-cow consult at the moment? Well, it will be more challenging for these herds because the risks are higher, and yet the new regulations will still apply. In other words, we can't use antibiotic preventatively and it can't compensate for management. So now is the time. We have, we'll say, approximately a year before the next dry period when the regulation will be applicable for spring calving herds. So now is the time to explore, why haven't these criteria been met? If there's no milk recording, if you're not milk recording as a farmer, or if you have clients that aren't, then it's essential to start now for multiple reasons. Firstly, again, as was referred to, I think even earlier in the presentations and by the minister as well, in terms of maximising herd efficiency, we can't afford to have passengers in the herds. We need to be able to identify the most productive cows and concentrate our focus on those. Milk recording will also facilitate good culling and breeding decisions. And it's an essential if we want to understand how mastitis is behaving in the herd and to be able to work with your vet and other advisors to develop appropriate solutions. And the reality is, next autumn, your vet will only be able to prescribe dry cow antibiotic for individual animals that actually need it, and that's to treat infection. And this is determined on the basis of what's referred to as individual cow information. In other words, milk recording results. And to quantify the benefit, and again, looking at the benefits of all of this, some research carried out in collaboration between AHI and Teagasc a couple of years ago, and was based on the National Farm Survey data. What they looked at, they matched herds that were milk recording and non-milk recording. So they accounted for farm and farmer characteristics. They were matched in those ways. And the only difference was whether they were milk recording or not. And what they found was that in the milk recording herds, the margins and the milk yields were higher. And the average bull tank SEC was lower. And this was all within the milk recording herds. So it's clear that there are practical and there are economical benefits from milk recording. If you are milk recording but still not meeting the criteria, then it's time to sit down now with your vet and your other advisors and use that information. Use the milk recording information, have good clinical mastitis records, and start investigating and understanding the pattern of infection within your herd. So in other words, what's the source? Where does this infection of these bacteria originate from? And how does it spread? Because knowing that, you can then decide on an appropriate plan of action. So make a plan of action that's determined by the problem that's there, not just the changes that you could possibly make. So you're making changes for a reason and not just hoping that they're the right ones to do. And then review and refining that plan. What about right now? So what are the things that you could go home and do? Maybe not tonight, but perhaps tomorrow. It's never too late to start milk recording if you're not already. And one of the key things about milk recording, as I mentioned already, as well as in terms of the tangible benefits, the timing of milk recording is really important. I mentioned already that the technical working group recommendation is at least 6 per annum. The reason for this is if we want to get full value and all of the benefits from milk recording, which are not just getting a prescription, but also being able to understand and manage mastitis and other health throughout the year, then we need to have enough information. So enough information means being able to have enough recordings to fit in over the lactation. 4 will be minimal. If we're only recording 4 times over a lactation, it won't allow us to record sufficiently frequently at the times of year that we need the information. And what I mean by that is, if you really want to evaluate your dry period performance, you need a milk recording within a month of drying off. But you also need to start milk recording within a month of calving. You won't be recording the whole herd, but you need to get started. And the reason for that is information. We need information, and we need a milk recording result from cows within 60 days in milk at most to be able to determine how their dry period performance was. So we can use their infection or their infection status, whether they're infected or uninfected, from that recording within 60 days of milk. We can use that to determine, did they remain uninfected over the dry period? Did they pick up a new infection over the dry period? Or did they cure over the dry period? Once we go past 60 days in milk, We can't draw those conclusions. So that's why we need to start early milk recording as well. The other thing to focus on is hygiene, excuse me, hygiene at drying off. So regardless of whether you're infusing intramammary tubes that are antibiotic, teat seal, or both, the hygiene at drying off is going to influence the success of your dry period. And finally, dry cow housing. Again, these are the key things at this time of year. If we're talking about right here and now, what are the key things to do to make the dry period a success? There are also a lot of additional resources available on the AHI website. You may be familiar, or you may have had some experience with the Cell Check Virtual Week, which ran during October. All of the resources that were already in existence and developed for the purpose of that week are available in one hub on the Animal Health Ireland website. And there are a lot of really useful things that will help you prepare both for the drying off and the dry period. Just a few, I suppose, messages to summarize. Remember, selective dry cow therapy can be an opportunity. So let's capitalize on that. Start milk recording now. If you're not already, it's never too late. Don't even put it off just until next year. Get started now so that you have a baseline of information. And remember, this is our last year to put a toe in the water. This time next year, the regulation will be in place and selective dry cow therapy will be a requirement. This is the last year where we have the option of even just starting small. Identify a few cows, a handful, that you're confident and that you've spoken to your vet about, that you're confident about just using teat seal only in these cows, so that you have a test run for next year so that it won't be so daunting when you have to do larger numbers. Sign up for a dry cow consult. If you don't meet the criteria right now, then work with your vet and your other advisors to get to the bottom of this. You have a year to focus on this and to improve the situation so that this time next year, when we are required to start selective dry cow therapy, the risks will be much less. Gormagat.
Thank you very much indeed, Finola. Again, I suppose the overarching theme of tonight is antimicrobial resistance and how we as a society, how as we as an industry, how we as professions and as farmers need to adapt. I mean, and I think there's no doubt it is challenging, but I think as you point out, and as the previous speakers have pointed out, it is a matter of starting. The first step is important, but I also think you focused also on the benefit, and then picking up a bit on earlier conversations as well, as the benefit of good health to farmers, health and well-being themselves. I mean, the stresses and strains of dealing with sick animals. Again, I suppose also focusing on data. I mean, milk recording as a source of data that will help improve animal health on the ground as well, not just in relation to dealing with the selective dry cow therapy challenge, but also to actually improve the bottom line for farmers in the context of improving their other health and improving the quality and quantity of milk being provided.